How to recognize and treat an infected wound. How will you know a wound is infected? And how would you know that the infection is spreading through the body? Stay tuned. Back. My name is Gwendolyn Halle. I'm a medical microbiologist. I'm popularly known as the medical professional with the difference because I bring you knowledge on health, medicals, hygiene, sometimes farming because I love farming, and business because I'm an entrepreneur as well. So today we'll be looking at how to recognize and treat infected wounds. Now, how will you know a wound is infected? Point number one, the smell. It will have a bad smell. Point number two, it will be reddish and swollen. Point number three, it could be oozing with brown or gray. It will have it will be oozing a brown or gray discharge or solution. And the fourth, pus. You will notice pus or a yellowish coating on or around the wound. Now, how would you know this infected wound is spreading over the body? Firstly, it will affect the lymph nodes. The lymph nodes in a human body are found behind the ears, around the tonsils, in the armpits, and around the groins, particularly where your pubic hairs are, the two lines of where your pubic hairs are. Now, if you have an infection around your head, your ear, your mouth, the lymph nodes behind your ears are going to be tender and sometimes painful. If you have an infection in your throat, your neck, the lymph nodes around your tonsil is going to be painful. Or in your mouth, the lymph node around here is going to be painful. If you have an infection on your arms, your chest, your breast, you have the tenderness, you have the lymph nodes around your armpit being very tender. If you have an infection on your legs, around your genitals, on your butt, your anus area, you're going to have the lymph nodes around your pubic hairs, like the two linings, like where if you're wearing undies, you know, where the rims of the undies touch, you're going to be having pain around that area. And the second point on how you will know that it is spreading, the infected wound, or the infection of the wound is spreading across the body, is that the person will start having a fever. The next is you start having reddish coating around the top of the wound. And you have this pus-like discharge very often. And also you have this constant oozing of brown or gray fluid from the wound. This is how you know that the infection is spreading around the body. But the fever and the tenderness of the lymph nodes is very, very, very common. So take note of those two. Now, what will you need to treat the infected wound? The first thing, you will run to your pharmacist or to your drugstore, you will grab saline water, and you will get a syringe and a needle, because that's the only way you can take out some of the saline water from this container. You know, this is 500 ml and it's actually 0.9% of sodium chloride. This is very good for wound. It will cleanse the wound really well. So before that, you need a pair of gloves, new gloves all the time. So just get a good pack of gloves. This is not about you washing your hands and disinfecting your hands. When a wound is already infected, you need to take all precautions to avoid any form of reinfection or complications. And you get compress, gauze, sterile gauze. This is very important. The sterile one, be conscious. They are on sterile gauzes or compresses. You get these, a number of these, because this is what you will be using actually to clean the wound. And you get yourself a new pair of scissors because you will need it to cut the gauze. A new pair of scissors. You get yourself a bottle of alcohol that you will use to sterilize or wipe the scissors after and before every use. So this is very important to get. Very important to get. And you will get hydrogen peroxide. Hydrogen peroxide is very good because it takes away those dead skin cells. It really cleans the wound. It's antiseptic. But at the same time, if you use it for too long, let me say if the wound has been cleaned or from all microorganisms and you are still using it on the wound, it will slow down the healing process. Actually, hydrogen peroxide kills microorganisms by oxidation. But on the other hand, it also reduces the healing process because it also kills healthy cells, the healthy cells that are trying to grow. So grab yourself one of these. I got myself one of these. I normally keep this at home. This is hydrogen peroxide, and in French it's low oxygen. And I got this from Gilbert. This is the Gilbert brand. And the gauze is media. One other product that you will need, that you must have, is iodine. And the brand of iodine that I have here is betadine. And this is iodine for the skin. There are different types of iodine. There's iodine for the mouth, oral infections. There's iodine for the skin, like this one. There's iodine for if you have problems with your genitals. So be very careful when you go to the clinic to buy, or the pharmacist or the drugstore. Say you want iodine for the skin. And this is a 10% solution for topical application. That is, Povidone iodine is 10 grams per 10 milligrams. So this is very good. It actually is very antiseptic, and actually it kills all microorganisms, that is viruses, fungi, parasites, and bacteria. So you need this, guys. Because of time, I'll do another video on how to clean an infected wound or a cut or a bruise at home. But I would like to take you through a summary on how to, what you will need, on how the process, on how you're going to clean an infected wound. The first thing is that you need to put on your gloves, two pairs of gloves, and you don't take any chances. You have your sterilized scissors, which you clean with alcohol, and then you take your gauze and you start with hydrogen peroxide. You pour it on the wound, you clean, you throw away this, you pour it on the wound, you clean, you clean. And then when you notice that all the dead skin cells, or all the reddish or yellowish or greenish or grayish kind of a tissue has been taken off, then you wipe it off and you put your saline. You use gauze to apply that in. You have to take some saline with a syringe, you pour it on, and then you clean as well. You clean the surrounding of the wound. And then the last part is you apply your iodine. And iodine is very good for wounds, actually. It's antiseptic. It kills all microorganisms, viruses, parasites, fungi, bacteria. So it's very good. And make sure when you go to your drugstore, you specify that you want iodine for the skin, for the dermis, because there's iodine for the mouth, there's iodine for the private parts. There are different types. So just be specific for what you want, and then you get it. Now, you have to be considerate about the type of plaster you're going to use on your patient's skin, because some patients are sensitive to some types of plasters. For example, my skin loves only the white type, you know, the sensitive one, the plaster made for sensitive skin. So any form of plaster put on my skin would irritate my skin. Make sure that you find out from your patient if they have sensitive skin or not, or if they're allergic to the regular plaster. This is very important, especially if it's a kid. Especially if it's a kid. While treating this patient at home, while taking care of this infected wound at home, you also have to give the patient antibiotics. The first is metronidazole, 500 milligrams if it's an adult. If the person is not an adult, then ask the pharmacist. Metronidazole will kill anaerobic bacteria. The next and the most important is penicillin. But try not to buy the generic form of penicillin because it has a lot of side effects. Even metronidazole. I think there's a brand name Flagyl, you know. Try and take something that, you know, will not make the patient feel sick while taking the drug. So try and look for other forms of penicillin that will be good for the patient. The next thing you have to do is make sure the infected parts of the patient's body, if it's an arm or it's the legs or whatever, is raised up. That will speed the healing process. For example, if the limb of a patient has an infected wound, the legs, you raise up the leg constantly on pillows, whether the person is sleeping or not. The person's leg should constantly be raised up. The next point on how to treat these infected wound at home is give the patient vitamin C fruits. Fruits high in vitamin C. Oranges, particularly pineapples. Give the person fruits that will speed up the healing process of the wound, that will promote, you know, the skin to regenerate or to produce healthy cells, new skin cells. Now, I like to say this with a lot of caution. If the infected wound is oozing out foul smell, if the infected wound is producing gray or brownish discharge, if the skin around the wound is dark, or the skin around the wound has blisters or bubbles around it, or the wound has bubbles around it at the site of the wound, please run to the clinic and get a health professional to look at the wound, because that patient may just be having gangrene. This is very important, guys. Don't go ahead and keep this patient at home with this sort of infection, because you may end up making the wound complicated and the limbs of that person may be cut off. Or if the infection is not on the limb, there may be more health complications, and that will be more money that will be spent. Thank you very much. If you have any questions concerning this video, please do pop it down below or send me a private inbox and I'll be willing to answer. Till next time, bye-bye.